Yeah.
I have a question, and it's kind of related to the other side of this. I mean, I understand the health insurance side of it. Looking at, just philosophically, with Medicaid expansion, I just talking to somebody a couple of years ago, they have planned surgery that they were looking at.
Okay.
It was a joint replacement, and they went out and they researched different places where they could get this done, and the cost varied greatly between different providers of the services, between like $25,000 and $90,000. And
Wow.
so I know that most of us, when we go to look for homeowners insurance or other types of insurance, we like to kind of compare. And I'd be interested to kind of know how many people, when they look at a planned medical procedure, actually go out and kind of compare services and compare costs.
Yeah.
Begs the next question, because if we're paying $90,000 for that versus we could have done it for 25, it's going to ultimately come back and drive that expense. I know that a lot of insurance carriers they negotiate that
Yeah.
charge on the back side, but should there be some kind of a federal mandate that is in place, for instance, like under Medicare, where there's a determined reimbursement amount for all the different procedure codes, for all the different providers, so
Yeah.
that when you're going to a provider, you don't go in for treatment on something and wind up with the insurance carrier getting a $4,000 bill when actually it's probably $1,000 service. Because when those things happen, we see it driving those medical costs for all the rest of us.
Yeah.
And you can layer the prescription stuff on top of that,
Yeah.
which is completely out of control compared to what versus what other countries spend for the same prescriptions.
Yeah.
So philosophically, how do you feel about federally mandating the costs that providers and prescription drug manufacturers can charge for services rendered?
Personally?
You don't know how refreshing it is to have a conversation about healthcare policy, because we have not been able to do this for 10 years. It has been so toxic to talk about. All you can do is say one word and everybody jumps at each other's throat. What's the word?
Obamacare. Federal mandate.
Obamacare, just say that. So your question is very valid. Your question, how do we affect healthcare costs? And in my opinion, the Affordable Care Act did not address that. It did not address it at all. And we're going to have to. Now, the Affordable Care Act was a political act. It passed Congress. And if we're going to start talking politics and healthcare, we got to have some very frank, very open, and in my opinion, very painful discussions. And I cherish the thought that we could do that. The idea that we could have conversations about these issues in our communities is wonderful. And in my opinion, we've just demonstrated we can.
I just want to add a couple things. I really appreciate your question. My sister is doing her entire PhD dissertation on transparency and how it affects consumer behaviors in the healthcare sector. So I think that is a huge question that she's toiling for the past several years to answer. And your question about federally mandating reduced costs, I think that if you look at, is a $90,000 knee replacement really that much superior to a $25,000? Probably not. And I mean, who's getting gold-plated knee replacement, right? So I think this idea of mandating, and like you talked about, health insurance companies negotiating the prices ahead of time so that, so that there's a fixed cost to things, I think makes a lot of sense. And that's the other thing to think about, so having just had a child, had I not been insured, that cost was going to be about $22,000, which is insane. So you get that bill from your insurance company and it says, the total, and then it says what price your insurance company negotiated and all that stuff. So, I mean, again, if I didn't have insurance, so driving down costs, if we insure people and there's negotiated prices, then that probably benefits all of us. Mary's telling me to wrap it up. We probably have time for a couple more questions, Mary? All right, Lorraine.
Well, one thing that healthcare users, that's me and you and everybody who gets sick and needs to go to a doctor, don't think of themselves as its consumers. And there's a big disconnect. Part of it is cultural, part of it is shyness, you know, part of it is, I don't want to ask the question of how much is this going to cost here, and do you know if I can get this done for less money there, because it just feels weird to ask that. But I got my comeuppance when, or not with my awakening, when my doctor suggested that I go see a particular specialist and have a particular test done. And I realized, and it was nothing medically necessary, it was her own intellectual curiosity. And I said, oh, I mean, she was a cool doctor because she thought about stuff, but wait a second, do you know how much these tests are going to cost? No. And you need to ask the question before you receive the service, if it's something where the cost is going to make a big deal. I know when my husband John Croft was sick, he discovered that having a PET scan up in Spokane at one of the radiology centers was vastly less expensive than having it done in Britain. And, you know, and that's one of those things that many of us have to have imaging at some point, and it's not, unless it's an emergency, yeah, call around, because you have to be part of the change. You have to be an aware and a feisty consumer of these things.
Thanks, Lorraine. Oh, yeah.
So, considering that like universities are like mandated as to provide healthcare to students, will this trickle down to improving? Just out of personal curiosity, will this, you know, I'm not a student or anything. Will this trickle down to improving healthcare access for like students at the collegiate level as well as those, you know, insured, you know, with their parents and everything? Like
Well,
that?
one thing I want to point out is that I don't think that that's a mandate.
Oh, well.
So LCSC actually is not mandated,
Okay.
and so there is no student insurance down there.
Really?
Yeah, so if
Is
you,
it university by university?
yeah, yeah,
Based
from what
on
I
what you all said,
understand.
that we're
So unless
required
you're,
to
I mean,
provide
unless
insurance.
you're able to stay on your parents' insurance, but we also have interacted with several students throughout this that, that their parents don't have insurance and they're unable to stay on their insurance, so.
So the history of why universities have health insurance requirements is based on the CAP fund. So there are 3 counties in Idaho that host large universities, in ISU, Bonneville County, and Latah County. U of I, and the U of I County Commissioners about 15 years ago went to the legislature and said, you've got to make these kids get insurance, because it was bankrupting the county indigent fund. And so instead of the legislature passing a law, the Board of Ed said they would require the universities to have students, for students to have insurance. So will it trickle down? Yes, because some students are also working, but they're not working enough to qualify for Medicaid, or go on the exchange, or they work too much to qualify for Medicaid, or to go on don't make enough to go on the exchange, or they're not on their parents' insurance. So there are some uninsured students that will be in the gap that would qualify for Medicaid. Not a lot, but some. So one last question, and then we're going to close it up. Louise.
Just a comment about the college students or our healthy younger people. I shouldn't have to have health insurance because I'm healthy. Well, the single biggest type of health care young people need is from the skiing accident or the car accident or the falling off the balcony. And those costs can just fly through the roof. And they don't happen a lot, but they happen often enough to say, yes, you do need health insurance.
Yeah, I think a lot of people were really frustrated with the individual mandate because nobody likes being told what to do. But the whole idea of that was to create bigger pools to help reduce the cost of insurance. So when, Tony, you're feeling frustrated about the increase of your insurance costs. One of the huge drivers of that was the repeal of the individual mandate because the pools got smaller and costs rose for everybody. So,
Well, thank you everybody for coming.
yeah, thank you so much.